So we're going to talk about social media and heart health, and this wonderful title that I think Tom came up with. So these are disclosures. I want to take you very quickly to social media just because it is kind of a thing that's overhyped, but how it may reflect practice. I'm using a social definition. This is a Wikipedia definition where people can tweak it and evolve. Computer-mediated technologies that facilitate the creation and sharing of information, ideas, career interests, and other forms of expression via virtual communities and networks. They all have common features which are shown on the right, sort of Web 2.0 architecture and the design and the usability. Everyone has a profile, they create content, and the profiles can be connected. And when we think of mass media, so you turn on the TV, this is what's happening, right? The TV is just blowing, pushing information out to a bunch of recipients. And of course, as we all know here, social media is really that the content is created by all of the participants, and they're the only people in the network providing content. The landscape of social media is very, very messy, and I think there's really 4 to be aware of and focus on: Facebook, Twitter, Instagram now, and LinkedIn. And these are screenshots from various things in context of healthcare. So a friend of mine decides to put his lumbosacral spine x-ray for input to see if the radiologist read it correctly. He's socializing it to his doctor friends. There's a Twitter feed next. The Chris Cannon, cardiologist, is talking about, sharing a news article. And then I went on Instagram, typed in Stanford Children's Hospital, and there's all these Instagram photos of people, presumably parents, posting newborns there, which I thought was kind of cool. So this is how to think about social media if you're not part of the landscape. Facebook networks people. Okay, so friends, grandma, baby photos, kids photos, it's people. It's usually friends and family. Twitter networks ideas, not people. LinkedIn networks industries. And Instagram does it all with photos, and that's sort of how we think about this. And the reason I showed you the mobile screenshots is because that's essentially how people are using the internet now. So more than half of smartphone owners use their phone to get health information, and it's very transactional, just like online banking. In fact, more health than banking. And if you look at the breakdown of age, this is 2015, it hasn't been updated yet, but we assume that there's more patients. The patients we see, older patients, are actually using this, albeit not as much intensity. If you look globally, it's definitely a thing. So this is mobile penetration across several continents, and you can see that the rate of rise is the same. It's just these curves get pushed out a little bit. Social media actually started in academia. There's this thing called DARPANet and Usenet and Internet Relay Chat, which started for professors and scientists to talk to each other. And this evolved, as you see here, over time in the things that we're aware of, proliferated probably about 6-7 years ago with Facebook. And medicine kind of has been late to the game at every step. There's a few sites / network sites that we use in social media or in terms of healthcare, and they're kind of shown here. And the reason I think Tom and others thought this would be interesting to talk about is why this may be important in healthcare. Recognize that the majority of people use internet now, and of those, 3 out of 4 engage in social media. And what's very interesting is there's more and more data that suggests that actually their engagement on social media influences healthcare decision making. Excuse the typo. 40% of people on the internet look at health consumer reviews, so they'll look up doctors on Yelp, and we know that there's been numerous studies looking at ratings and correlation of quality of care, and they're not there, but what else do patients have to go by? A lot post healthcare experiences, but they tend to be more trusting from content from MDs as opposed to those from pharmaceutical and device companies. There's now 165,000 health and medical apps, which is another problem. And it's a moderately big business because the barrier to entry is so low. So why get in the game at all? Why should you? Well, you can get information faster. There's a lot of live tweeting that happens at meetings. We had the power go out at my house when we were traveling. I got a notification from my alarm system that was out, and I wanted to know if it was out at my house or if other areas were affected. So I just went on Twitter and put in my town and power, and I saw a few people tweeting that they lost power, so I knew it wasn't something like our house wasn't burning or something. It was useful. Visibility as an expert to network, and of course dissemination of research and ideas, and really the goal is to extend your reach. Why might this not be worth your time? There is still no clear return on investment or business case for most clinicians. It's hard to translate this into being a doctor and seeing patients directly. There may be sort of unintended or downstream benefits, and you could say, well, I don't need to deal with this. My hospital and their media program will support me, and I don't have to do anything, and let it be turnkey. That's fine. It takes time. You're putting yourself out there, so there's risk, and maybe you just don't have a personal or cultural preference to be real time all the time, or have more privacy. The other issue is, how do you possibly manage all these social relationships? So there's this thing called Dunbar's number, the suggestive cognitive limit to the number of people with whom you can maintain stable social relationships. Any idea? Anyone want to guess what the number is? A number of people with whom you can maintain stable social relationships. 0. 1.
That's you, Manny.
1. Your wife, maybe, but so it's actually 150, right? It's not that high. And like you have 500 people on LinkedIn and who knows what on Facebook. At some point, it just doesn't really matter. This is your core go-to group. This was derived based on brain sizes, looking at social networks going all the way down to rats and bigger primates and showing distinct correlation with brain size and the size of the network. And that's how we got to 150. So visibility as an expert. Well, you can tell your story to a variety of audiences, which are shown here. Journalists tend to seek out clinicians who are on Twitter. So that's sometimes why you see the same people kind of quoted in media releases. You can also just be a casual observer and look and get a source of information. But ultimately, in certain groups, your value increases because you become accessible in another way. It's not, email is too hard. We don't pick up our phones all the time and it goes to voicemail. And voicemail for me is like a black hole. So this is one way of increasing accessibility. And there's really 3 forms of interaction you can consider. Curation is when you're posting content that you find interesting. So Eric Topol does this all the time. He actually has this knack for getting really cool stuff and presenting it on Twitter. And a lot of what he shows is super interesting. Mike Gibson does the same thing. Community is if you're part of a group or you want to engage them in one of these social networks. And creation is the hardest one and unclear ROI because you're actually creating content and you're just putting it out there for free. And what is the downstream value? So that's the order of doing things in terms of effort is listed here. Now, I'll talk a little bit about research and why is this important for research? Well, you can use it as a tool for recruitment, collaboration, and dissemination. And the dissemination argument is that taxpayers who fund your research don't read medical journals. Right? So you can make a very strong activist argument there. The other is as a data source to really see what's going on and how people might perceive various phenomena happening in the world. We'll talk about dissemination. So the online dissemination in any form only reaches those who seek information online. And the user base for Facebook may not be the most applicable place for your research. So you have to think about the who is your audience problem. And mainstream media still has the best reach for news stories. Twitter is, again, kind of become the place for dissemination. And if you just look at sort of what your monthly audience could be, this is from a study where they look at methodology, taking averages, you go up sort of exponentially with scale in terms of reach. But just because eyeballs see it or scroll past it doesn't really mean that they're engaged anymore. So you have to take this with a little bit of temperance. Now, you can actually measure social media reach in healthcare and in research. So there's a company called Altmetric, and they created an Altmetric score, which is an example of social media reach. And if you go to JACC and all the ACC journals, they'll have an Altmetric score. It'll be inside of that little circle you see on the top left, and it'll tell you what the score is. So if you can actually go to their site and look at the top 100 papers. Does anyone know what medical journal publication has the highest Altmetric score? It's Obama's Affordable Care Act viewpoint in JAMA. So I guess he just does it all, right? How do you get past that? So he has the highest Altmetric score ever, and that's because he's the president. But there are actually papers for cardiology from JACC and other places in the top 50 as well. And that looks at kind of measures reach, media coverage, Twitter, et cetera, et cetera. And then the other kind of interesting thing is, well, what about scholarship and advancement? So the Mayo Clinic is now including social media scholarship in academic advancement as a measure of your total impact and reach. And I think this has problems because Why then social media? What about all media? What about TV appearances and this and that? But this is the first large institution, to my knowledge, that is sort of experimenting this in academic advancement. So what are some of the challenges and barriers? You'll often see this disclaimer on people's profile that my tweets are my own, indicating that they're not representing an institution. Well, if they weren't representing an institution, why do so many people get fired after they post something on Facebook and Twitter? It's not your own. You are projecting, who employs you or something else that's affiliated to you, and there can be conflicts of interest with the hospital and with the university. So, if you're going to rant on JACO and HIPAA online, be careful. Professional versus personal identities, who do you really want to be? And then patient data. So putting patient data is a fascinating issue. Now, a lot of healthcare systems and hospitals have their own policies on social media, as does the AMA. I don't believe, but I could be wrong, but I don't think any of the cardiology societies have that yet. If you're an electrophysiologist and you want to see cool cases, just go to Twitter. There's all this cool stuff here. And I don't engage in this because I don't really know what the legal ramifications are. I don't know if these patients gave consent. I don't know if there's an expectation that they should have. I don't know if a patient sees their own stuff online and they would have an issue with it. Are these patients identifiable? There have been a number of times where I've actually seen the patient's name posted, and I sent a private message to that person. It's like, hey, you might want to blur that, just letting you know, because it's clear from the picture. But if you want to see interesting cases in ECGs, go to Twitter. They're all there. I just don't know where this is going to kind of go in terms of policy, guidelines, and liability. There's also this whole issue about conference tweeting. So AHA, ACC, they have a lot of this going on, but this created a firestorm last week. So the American Diabetes Association had the bright idea of trying to censor social media. So every time somebody posted something with ADA, they said, thanks for joining, photography isn't allowed, our policy in place because slides are unpublished, blah, blah, blah. And sharing is sort of permitted, tolerated, or embraced at ACC, at AHA, at other places. So maybe there are copyright issues, but if they're presenting it, it's in the public domain already. It's not like you signed a confidentiality agreement to attend ACC or to attend the American Diabetes Association. So the firestorm, interestingly enough, led by two cardiologists, Martha Galati and Mike Gibson, for a diabetes meeting, clearly showed that the online community really didn't like this. Let's talk very quickly about trials. So some of you may have trials at your center, and we go to centers to do trials to enroll patients. That's very expensive. What if you can get patients directly? What if you don't need the site all of a sudden? What if you can frame the consent and the baseline visit to be electronic? This is already happening, and we used to think this was like cool or demonstration projects or niche, but I was at DIA, which is the Drug Information Associates meeting. It's this big pharma clinical trials meeting that was at McCormick last week. That's how big it is. And everyone's getting into the game. Like IBM Watson had a booth there because they want to use artificial intelligence to find patients and then do case ascertainment through case report forms that you scribble on. This is a whole interesting wave of things happening. But what if you could recruit? And we've done that with My Heart Counts, which I'll briefly show. But the pharma companies are going straight to Twitter to try to get patients enrolled in studies. My Heart Counts is a cohort study that's run by Ewan Ashley, one of my colleagues at Stanford, and there's no sites. That you just go to the App Store, you download it, you fill out the consent, and 40,000 people, once it was announced by Apple, signed up online. So imagine if you could get that kind of rapid enrollment for other kinds of studies. There are other portals out there like Achievement, run by Evidation, where patients can sign up and say, I have diseases X, Y, and Z, and you can go directly to them. Again, this whole idea of siteless trials. And the Google Baseline study, which is a cohort study run by Google with some partners, including Stanford and Duke, is also going to be getting patients online, though they will have a site visit at Duke or Stanford or a couple other places. The downsides are what social media can do to trials. So researchers fret as social media's lift the veil on drug trials. This was from Craig Lipset, who runs the innovation group at Pfizer. So this is people posting in online forums trying to game the system of randomized double-blinded studies. The placebos were sweetest to neutral tasting. That's how all placebo people interpreted their pills. Or in a case of HIV studies where patients were supposed to be blinded to viral loads and patients wanted to know if the drug was working early, they were advised by colleagues on the network to go get their viral load. So this can seriously affect the conduct of trials now. And then what if people start saying, oh, I have this, I get a headache, and is this adverse event reporting if somebody posts it on Facebook? People have done some work on using Twitter as a data source. It's not really that useful yet, specifically for cardiovascular disease. So I'll close here and just say that social media is where our patients, customers, consumers, and colleagues are, although the hype factor is admittedly very, very high. The clinical and academic footprint or impact can extend well beyond traditional domains of publications or talks and meetings. And because an active presence takes time and energy, you got to decide if it's the right thing for you, and then I think you do it with purpose and focus. You got to figure out who you want to be. And if you want to get started, you just open an account to start observing, and then you can decide what you want to do. Thank you.